Hello, my name is Johanna and I am a nursing student at Miami-Dade College Medical Campus. Today, I am going to discuss proper body mechanics. Proper body mechanics is a thorough topic, and although I don't have the time to cover all the concepts within the scope of body mechanics, I will try to cover a few subtopics that are relevant to nursing. One major source of injury is back injuries, which account for about 20% of all injuries and illnesses in the workplace. Nursing personnel are among the most at risk for musculoskeletal disorders. The American Nurses Association, or the ANA, researched the impact of musculoskeletal injuries, and they indicate that 30% of nurses who acquired back pain were required to leave work. 12% of nurses left the profession as a result of back pain. Proper use of body mechanics helps prevent injuries to clients and all members of the health team. Today I will outline the basic principles of proper body mechanics to keep you safe from harm. The first step is to determine the need for assistance in moving or turning a client. Do not hesitate to ask for assistance. Once that has been established, it is important to have the proper stance. First, we want to establish a firm base of support by placing both feet flat on the floor, with one foot slightly in front of the other, as seen in the picture. Both feet should be distributing weight evenly while knees are slightly bent. This allows strong muscles of the legs to do the lifting. Hold the abdomen firm and tuck buttocks in so that the spine is in alignment, because this position protects the back. Hold the head erect and secure your firm stance. Make sure to align the three natural curves in your back: the cervical, thoracic, and lumbar, because this allows the weight of the client to be evenly distributed throughout the spine, lowering the risk of back injury. This picture shows the right way to align the back. Notice how the back is a straight line. In the third picture, we see that the spine is curved. That is very wrong. Next, we want to maintain the weight to be lifted as close to your body as possible, because this position maintains the center of gravity and provides leverage that reduces lower back strain. The center of gravity will be discussed in a few minutes. Very important, prevent twisting your body when moving the client, and this applies to all actions, whether you're turning or lifting, because it prevents injury to the back. So now that we know proper body alignment techniques, the next step is to maintain these techniques. The next topic is maintaining proper body alignment. First, you want to make sure you begin with the proper stance established in the first topic. Then, evaluate the working height necessary to achieve your objective. Try to find a comfortable height that works for you. The usual height is between the waist and the lower level of the hip joint. Test that level by extending your arms and checking that your body maintains proper alignment as seen in the picture. If you need to work at a lower level, do not bend your waist. That results in back strain. When necessary, flex your knees. Work close to your body so that your muscles are not hyperextended. Use your longest and strongest muscles like your biceps, quadriceps, and gluteal muscles when moving and turning clients. Whenever possible, roll, push, and pull objects instead of lifting. Another topic of concern is how nurses constantly need to get materials and supplies from cabinets or other high places. We need to make accommodations for working at high surface levels. Do not use stretching or twisting movement when you reach for objects out of close proximity to your body. Please keep your body in correct alignment when turning and reaching for objects to prevent muscle strain or back injury. This nurse incorrectly uses stretching or twisting movements when reaching objects out of close proximity. Do not hyperextend the muscles. In this picture, the nurse keeps her body in correct alignment when turning and reaching for objects. Again, this prevents muscle strain or back injury. Another common principle is to work close to the body so that the center of gravity is not misaligned. Maintaining the center of gravity means that the weight on all sides of your body is generally equal. As seen in this picture, bending over incorrectly injures back muscles and causes undue stress. On the other hand, working closely to the body keeps the center of gravity aligned and no part of the body is being strained. please refrain from hunching over or stretching in the workplace. The next topic deals with moving objects. When moving an object, we want to stand as close to the object as possible and place yourself in proper body alignment stance, as seen in the picture to the left. We want to let our arms, hip, and thighs do the work. The nurse is providing a basin to wash the client's feet, as seen in the picture. Is this proper body alignment? No. In this picture, we see that the nurse is holding objects away from the body, and this is not aligned with her center of gravity. It's away from the center of gravity. As seen here, we need to always keep objects close to the body to prevent muscle strain and back injury. As we see in the next picture, the nurse keeps her body in proper alignment by not twisting her body, keeping her back straight, keeping the object in front of her, and not extending her neck. Now, the nurse is placing a basin near the client's feet. Is this proper body alignment? No. Again, we see the nurse is bending her back. There is a huge potential for back injury. As seen here, the nurse correctly keeps the object near her center of gravity and remains her spine aligned. Please remember, do not twist the body. That is very important. The nurse here should not be twisting to place any object on the floor. Another common task for nurses is pushing carts. When we push an object, like a medicine cart or a cart of supplies, we want to place ourselves in proper body alignment and stand close to the object while applying all previous principles, which include no twisting, no bending at the waist, and constantly maintaining a balanced center of gravity, not like the nurse on the right. This concludes the lesson on proper body mechanics. Although not all areas were covered, I hope this review helps you in preventing any back injuries. But before I conclude, let's review the main points. 1. Ask for help when needed. We should never feel alone in the hospital or whatever establishment we're in. 2. Assume a proper stance before moving or turning clients. 3. Establish a comfortable height when working with clients. 4. Avoid leaning and stretching and twisting. 5. Keep the client and objects as close to your body as possible when moving. 6. Use large muscles for lifting and moving, not the back muscles. Move the hip and shoulders as one unit. Take frequent rest periods to prevent additional strain. Thank you for listening and stay safe.